The swine flu pandemic hasn't dominated the headlines in recent weeks as it did some months ago, but the danger still lurks. So as nearly 1.5 million New Jersey school kids get ready to head back to class in the next couple of weeks, top state health and education officials gathered today for a summit on swine flu preparations. NJN News health and medical correspondent Sarah Lee Kessler was there and has this report.
What do we have to decide?
At this point in the year, teachers and administrators are usually worried about how much knowledge kids have forgotten over the summer. But now there's something new to add to the mix. Concerned that novel H1N1 influenza, or swine flu, will strike the first week of school.
It will really be the first time in memory that we've had such an incredible health challenge as we open the doors of school. So what could begin as a few sniffles in one of your second or third grade classrooms could spread very quickly throughout an entire school.
At a joint summit today in Monmouth Junction, held by the Departments of Education and Health and Senior Services, the focus was on preparedness.
We know that the partnership between public health and education will continue to be crucial in this fall's response to H1N1. The issue of school closings, vaccinations, and communications will all be critical to keeping as many New Jersey residents as healthy as we can.
It's a big issue here, where swine flu, first identified in April, has claimed 17 lives and sent more than 500 New Jerseyans to the hospital. The goal of today's summit, to solidify a coordinated response.
Is to sort of think of it as seasonal flu plus a little bit extra. So many of what you have in place for seasonal flu, how you manage that in your communities, will work for H1N1. And if it comes back more severe, then we're going to manage it with more effort.
Public health officials and educators are preparing for a mass vaccination and education campaign, but that doesn't mean a one-size-fits-all solution. It depends on the community.
That means that the solution is going to be as unique as you are. In some cases, the school nurses are going to be involved in actually giving the vaccines, and that's been a decision made with the school administrators, with the local health departments, with the government agencies, with the communities themselves.
The first batch of swine flu vaccine, if proven safe and effective in ongoing clinical trials, should be ready in mid-October. It will be administered in 2 doses, given 3 weeks apart. But seasonal flu vaccine is available now, and health experts recommend getting yourself and your children vaccinated right away.
Well, it's about community protection. We're here to protect each other. You want your neighbor to be as considerate of you as you should be for them.
And that means knowing when to stay home and when to come to school.
It really resonated on how much emphasis we place on perfect attendance. If someone is sick, I don't want them in school, I want them home.
But that doesn't mean the types of school closings we saw last spring. The CDC now says schools should stay open, if at all possible.
Closing schools too quickly meant that kids were still congregating elsewhere and they might still be spreading diseases.
I think it makes a lot of sense for healthy children to stay in school and to keep learning.
And that includes college students. Tomorrow, Health Commissioner Heather Howard says she'll address the issue via conference call with college administrators across New Jersey. Sarah Lee Kessler, NJN News, Monmouth Junction.